Hi guys, today I will explain you surgical operations. It's include to the topic of perioperative period. It's a big topic and I want to explain you it some more. Okay, today we will talk about types of surgical operations, types of surgeons, and let's get started. Okay, we have many classifications of surgical operation. The most important classification you see in your laptop, yeah, or maybe video. I don't know what you look, phone, laptop, how you want. And usually we divide, we delete the classification for operation what according to the urgency of the implementation yes, and the possibility of a complete cure or relief of the patient's conditions. If we will talk about first classification, yes, according to urgency, we delayed these operations for three types. First type is emergency. Yes, emergency operations perform immediately or in the next few hours from the moment the patient is admitted to surgical department. For example, when we talk about acute appendicitis, we need to understand that it is emergency situation and we need to do emergency operation. We have 6 hours to do this operation. If we talk about perforation of gastric ulcers, we need to understand that it is emergency situation and we need to do operation in first 6 hours too. What is urgent? Urgent operations performed in the next few days after receipt, after medicament treatment. Example of urgent operation is acute cholecystitis. Yeah, we have 48 hours to do operation. The next one type of urgent operation, it is osteomyelitis, for example, osteomyelitis, for example. And the third one, it's not urgent situation, it's a planned situation. This situation are performed in a planned manner, planned management, because they cannot lead to death. Yeah. Okay. The example of the planned operation, it is a abdominal hernia, for example, non-acute situation, yes, without complication, just abdominal hernia. The next type of our operation, yeah, we talk about possibility of complete cure, and there we will talk about radical operations and palliative operations. Let's start talking about radical surgery. They consider it to be an operation in which the return of the disease is excluded by removing the pathological formation, part of all of the organ, the volume of surgical intervention that determines its radicalism is determined by the nature of the pathological process. In benign tumors, for example fibroids, lipomas, neuronomas, polyps, their removal leads to a cure for the patient. In malignant tumors, the radicalism of the intervention is not always achieved by removing part or all of the organ. Given the possibility of metastasis of the tumor, therefore, radical oncological operations often include the removal or resection of neighboring organs, regional lymph nodes, along with removal of an organ. So the radicalism of surgery for breast cancer is achieved by removing not only the entire breast, but also the large and small pectoral muscles, fat, along with the lymph nodes of the axillary and subclavian regions. When we talk about inflammatory disease, the amount of intervention that determines the radical nature of the operation is limited to the removal of pathological altered tissue. For example, osteonecroectomy is performed for chronic osteomyelitis, or the removal of a pathological altered organ, appendectomy, cholecystectomy, and others. The next one, palliative. Palliative operation. Often we talk about palliative operation when we talk about cancer. But of course, we can talk about palliative operation not only when we talk about cancer. When we talk about palliative operation, these kind of operations performed to eliminate the immediate danger to the patient's life or to elevate his condition. So, the decay and bleeding from tumors of the stomach with metastasis, when radical surgery is impossible because of the prevalence of the process to save the life of take gastric resection or wedge excision of the gastric tumor and the bleeding vessel. With a widespread esophageal neoplasm with metastasis, when the tumor completely obstructs the esophageal lumen and it becomes impossible for food and even water in order to prevent starvation. A palliative operation is performed the imposition of a fistula on the stomach. We call this type of operation gastrostomy, through which food is introduced into gastro. Palliative operations can stop the bleeding or allow nutrition, but the disease itself is not eliminated. I can explain it with more easier words. When we talk about radical operations, we have a problem and we can take this problem away. But when we talk about palliative operations, we have problem, but we can't do this type of operation to take this problem away. But we can do something another. Yeah. For example, we can take away this part. Yeah. We don't take away problem, but we help patient. We stop the biggest problem, yeah, without radical operation. Yes, it leads to many complications, and we will take away some years of patients, but there in these types of operation we try to save his life. Yeah, it's a war and we have just few seconds. We can't do a radical operation, but we can do palliative operation. The next classification of operations is classification about steps of or stage of operation. We can talk about one-step operation or one-stage operation or multi-step operations. One-step operation, its stage are performed directly one after other without a gap in time. Each of the multi-step operations consists of certain stages of surgical treatment of the patient, separated in time. As an example, we can cite multi-stage operations in... I will tell you another example. For example, one-step operation, appendectomy. Great. Multi-step operations. We do some kind of we go to the operation and we know that patient have intestinal obstruction. How we can help him? We see that intestine is delayed, yeah? And we see a place of necrosis of intestine. We need to do a resection of this place of intestine. And what we will do? We take away intestine and we need to do a anastomosis. But we see that condition of patient and condition of intestine is not good for anastomosis. We take what we do. We closed two ends of intestine, yeah, and do suturing of our wound. And for this operation, one step is over. Yeah? And we need to do a second step of operation. We need to do a re-laparotomy, yeah? And do an anastomosis. And this we will call a multi-step operation, or we will call a type of operation like second look. Simultaneous operations. It's kind of operation where we do 2 or more operations. In modern conditions, with the development of anesthesia, intensive care, yeah, it's possible to do simultaneous operations, where we do 2 or more operations in a patient. For example, a patient with an inguinal hernia and varicose veins of the large saphenous vein can perform 2 operations at one time: hernia repair and phlebectomy. In patients with gastric ulcer and chronic calculous cholecystitis, gastric resection and cholecystectomy can be performed simultaneously, and we can use a single surgical approach if the patient is in good condition. Trial operation. In surgical practice, there may be situations when the question of the possibility of performing the operation is resolved only during the surgical intervention itself. This applies to oncological disease when a tumor is diagnosed in a particular organ. Radical surgery is expected. During the intervention, it turns out that the planned operation is impossible due to the tumor metastasis to distant organs or germination to neighboring ones. This operation we called trial operation. Diagnostic surgery. Now, when we have many types of diagnostics methods, we don't do a diagnostic surgery. But when we talk about urgent pathology, and when we can't say that in this case we haven't got urgent pathology, we can do a diagnostic surgery. Yeah, for example, diagnostic laparoscopy or laparotomy. When we talk about tumors, yeah, when we talk about oncology, we don't do a diagnostic surgery, but sometimes our surgery can be diagnostic. For example, we won't do to patient a resection of lung, yeah, or lungectomy, and our CT scan, yeah, or say us that it's possible stage of this tumor don't contraindicate this operation, and we do it, and we see that our pleura has metastasis. Sometimes in CT we don't see this metastasis, and when we see this metastasis, we understand that it is another stage of oncology, and we do a biopsy. What will say us what kind of tissue we have, what kind of cells, and how they will treat it, how we can treat them. Typical and atypical operations. Yes, standard or non-standard operations. Typical operations are performed according to well-developed schemes and methods of surgical intervention. Atypical situations arise in the case of an unusual nature of the pathological process that causes the need of surgical treatment. This includes severe traumatic injuries, for example, especially combined injuries, and gunshot wounds. In these cases, operations may go beyond the standard, require the surgeon to make creative decisions when determining the scope of the operation, performing plastic elements, performing simultaneous intervention on several organs, vessels, hollow organs, bone, joints, etc. Closed and open operations. There we include reposition. When we talk about closed, reposition of bone fragments, some types of special operation, for example, endoscopic operation. When we talk about laparoscopic operation, turning the fetus on its legs in obstetrics. Open operation, when we talk about laparotomy, for example. Microsurgical operation. It's another level of operation. There we use another instrument. We working in small tissue, with nerves, arteria, nerves, vessels, ligaments, and others. Microsurgical operations performed under magnification from 3 to 40 times using magnifying glasses or an operative microscope. In this case, special microsurgical instruments and thinnest suture treats are used. Microsurgical operations are increasingly being introduced into the practice of vascular surgery and neurosurgery. They are used to successfully perform limb and finger replantations after traumatic amputation. Endoscopic operation. There we use endoscopic devices. Through an endoscope, polyps of the stomach, intestines, and bladder are removed, and bleeding from the mucous membranes of these organs is stopped by coagulation the bleeding vessel with a laser beam or closing its lumen with a special glue. With the help of endoscopes, stones are removed from the bile ducts, bladder, foreign bodies from the bronchus, esophagus, using endoscopic equipment and TV equipment, perform laparoscopic and thoracoscopic surgery. We can do some kind of operation like cholecystectomy, appendectomy, closure of perforated ulcers, resection of the stomach, lung closure of the bull in the lung, bullous disease, hernia repair. Such closed endoscopic surgery have become major in a number of diseases: cholecystectomy, resection of the lung boundary, or are an alternative to open surgery. Taking into account the indications and contraindications, this type of operation is increasingly used in surgery. Endovascular surgery is a type of closed intravascular surgery performed under X-ray control. Expansion of the narrowed part of the vessel using special catheters, artificial blockage, embolization of the bleeding vessel, removal of atherosclerotic plaques. It's a very hard type of operation because surgeon always will working with X-ray. It's a big dangerous for surgery, yes, but it's very interesting. Repeated operations. Repeated operations can be planned when we talk about multi-stage operations, multi-steps operations, and forced with the development of postoperative complication, which can only be treated surgically. For example, it is laparotomy or laparoscopy in case of failure of the intestinal anastomosis sutures with the development of peritonitis. That's all what I want to tell you today, what I want to explain you today. Yes, and now small examination for you. When we talk about acute cholecystitis, what type of surgeon we need to do? When we talk about acute appendicitis, the second question, what kind of surgeon we need to do? Classificate it. The third question, what you see on X-ray? And the last question, what operation you see in the page? Oh no, it's not last question, it's question number 4. And question number 5, you need answer what the blood group it is. Okay, thank you for your attention, be healthy, bye bye.